Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, Anita Finley.
I have a very special physician that we're going to talk to. Her name is Dr. Ann Zachariah, and she is actually a cardiologist. And I believe that you are at you're at Broward Health, and you are at the Imperial Point. Is that correct?
Yes.
Well, I love Imperial Point. It's such a wonderful hospital. You know, it's not one of those real huge hospitals, but they do have incredible physicians. And how long have you been there?
It's only the third week. We just moved 3 weeks ago.
My goodness.
But I've got to tell you, the hospital is awesome.
I know it is. And I have to tell you, it is, but I have to tell you something very funny. I have never known anyone who did anything in Patterson, New Jersey, and I lived there for about 5 years when I was a little girl.
Oh, we went to St. Joseph's Hospital, and it is a big hospital group now.
Well, I was there probably something like I don't know. It could be 75 years ago or something, or maybe 70 years. But I loved when I saw it. I said Patterson, New Jersey. That's great. Well, tell me about your family. That's very interesting that all of you chose to be physicians in the field of cardiology. How did that happen?
Actually, I am married to one of the Dr. Zacharias. That's Dr. M.P. Zachariah. He's a cardiologist. And his brother, Zachariah is a cardiologist.
And so go ahead.
And I was fortunate to be born in a family who encouraged education as the most important thing. And they guided me, and my teachers were all wonderful. And I was honored and blessed to become a physician. And there it goes.
So why do you love cardiology? Of all the other specialties, you could have been a brain surgeon, or you could have been, an oncologist. Tell me why the cardiology appeals to all of you, as a matter of fact.
For me, the amazing heart, the architecture, the working of the heart is all very amazing, more than imagination can take you. And I was always intrigued, and I did work in emergency rooms in St. Joseph's Hospital while I was doing my residency, and happened to see a lot of patients with heart attack. And during residency, I decided I'm going to be a cardiologist so that I can do something about it and be there and help them when they are facing a definite mortality. So this was a condition where you can make a big difference.
Let me ask you a question. Do you work with cardiac surgeons? How does this work? Where's your position, and what happens then?
There are two kinds of medical cardiology. One is called clinical cardiologist. I am clinical cardiologist, where I diagnose the problem, and if they need non-invasive testing like echocardiogram or stress test, I do them. And when you diagnose a person is having impending problem or problems that are serious, you refer them to interventional cardiologists. That is my brother-in-law, Dr. Zachariah, and my husband, Dr. M.P. Zachariah. And they are the ones who do the procedure called cardiac catheterization and find the degree of blockage a person has. And if it's critical, they open it up with stent deployment. And that prevents heart attack even before it happens. So this is a very, very thankful and grateful field for the physician and for the patients when you can help them before the heart attack occurs.
Yes, absolutely. Let's go all the way back then and talk about blood pressure. This is what you would be working with your patient first, isn't it?
That's right. One of the most common conditions in the Western world is high blood pressure. In fact, right now, the study has shown anybody that is older, that age is 55, will get high blood pressure at some point in their life. Part of it is aging process. Part of it is other conditions that causes it, like obesity, inactivity, sedentary life, diabetes, and consumption of lots of salt. Where we are affluent, having 3 meals every day and wonderful food given to us, it's easy to get high blood pressure. In addition, as we age, our blood vessels change. Like we have gray hair, which can be easily seen inside the body. There are changes that occur in the vasculature, that is in the arteries of the heart as well as in the leg. They become more stiff and non-compliant. The elasticity leaves. Therefore, the blood pressure rises. There is a word called resistance. As you know, there is some resistance in blood flow that raises blood pressure automatically as we get older.
Well,
and
that's keep going. This is a wonderful thing for people to be hearing.
Yes. So it can be a disease of the early life or it can be latter life. Latter means above 55. And another group suddenly may raise blood pressure after 80 to very high levels. That could be from kidney problem or from other glands called adrenal glands that functions inside the body. So these can be diagnosed early, treated appropriately, and we can prevent a whole lot of stroke that will happen. As we age, our vessels become very stiff, and as I said, they are prone to bleeding, especially in the brain. We call them end organ damage. Having high blood pressure for more than 5 to 10 years starts problem with the kidney, the heart, and the brain. And these are preventable problems. And it requires quite a lot of teaching and education. The problem is most people deny that they have high blood pressure because they may check it at home, it may be okay. Whereas diligent follow-up with a physician and themselves can identify this early and perhaps completely stop some of the high blood pressure that causes stroke. In addition, it can also produce something called aortic dissection, where the major artery can tear into pieces, and people usually die immediately. Thankful to some of the wonderful surgeons in many of the hospitals that we see, they may fix some of them, but a lot of them will die suddenly. So it's so important for the public to know this is not under their control completely. The more knowledge and education we impart to the public, they will understand that this is a problem which is silent and nobody can be in control of it unless they're very careful about it by lowering weight, taking the salt intake way low, and changing the lifestyle, even exercise. Some of the very simple things can change a dramatic difference in a person's life and the blood pressure readings.
I know that I've been, I check my blood pressure, and why does sometimes it goes up, then it goes down, it goes up and it gets down? Why isn't it always steady? I mean, I check at the same time in the morning, but it does fluctuate.
Yeah, it does fluctuate. They have found out the ability to fluctuate the blood pressure is a healthy condition. But there are limits. If it goes beyond 200 with limited movement, that's a problem. Whereas if you're running at a very high level, it can go up to 200, but the bottom number should not go above 90. So fight, flight, fright should increase blood pressure. It may be that you're in a traffic jam. It could be you heard something bad in the TV or in letter, phone. All that will raise blood pressure a little bit, but beyond a certain limit is unacceptable. That is also one of the hallmark. If it goes about 200, it's a hallmark of future problem. So fluctuation over the day with activity and emotional condition of the person is normal and is very healthy. Nevertheless, if it swings rapidly to high levels, and especially if blood pressure drops during exercise, it's a very bad prognostic sign.
Well, it's not, thankfully, that's not happening to me, but I was thinking about what you were saying, and it really sounds like it's prevention. Going to your doctor, going to see you, for example, and making sure that you have a hold of things and you know what's going on, and to go on, especially once you're 60 years old, 50 years old, you should go on a regular basis and make sure that you have someone watching what you're doing.
That's right, and impart that knowledge. Most of the patients who have high blood pressure, if a doctor spends a little bit time, they become very much in control of their blood pressure. They'll call you from home saying, "Doctor, my blood pressure is high." So that's a part that is going to be missing in the future because of short time spent with the physician. But I think the more education we give to the public, especially the aging public, they will get better. They will be advocate for themselves, and the physicians have to be responsible to give them that education.
Well, I love having you talk about this. In fact, unfortunately, I think I've only met male cardiologists. I've never met a female cardiologist, and I don't know why that's true. I happen to be a gerontologist, so I've been in this field, but I'm trying to think back. Do I know any? No.
It's a field that is, now there are many graduating, but when I was graduating in New Jersey, I was only one when I was in fellowship.
Yeah, I see that. So that's interesting that would happen. But let me just tell you, I'm the publisher of Boomer Times, and we have a wonderful ad, and it's featuring you and your husband and your brother. Uh-huh. And I mean his brother, right?
Yeah,
and
his brother.
Yeah, his brother. And it says patients who come to Broward Health in Imperial Point for their cardiac care will benefit tremendously with the Zachariah's collective years of extensive medical training, cardiac health awareness, interdisciplinary approach, and compassionate care.
Yes.
The newly expanding cardiac services will include cardiac catheterization, stent procedures, and the building of a chest pain center, which will expedite the assessment and treatment of those suffering with chest pain. Wow, it looks like you have really you've brought so much that they're starting a whole new center for you.
That more importantly, we feel that we are honored and privileged to be a part of this venture, since the people who live in this vicinity should be able to have access to wonderful care. And when each hospital do better, then it's competitive better. Everybody will get better as time goes by. So
Right.
It'll be our honor to do everything. In my part, I'm a clinical cardiologist, so I'll be mostly involved in education, giving that compassionate care, which we did last many years. And my husband and my brother-in-law will be definitely involved in the interventional part of the care, putting the stent and spearheading with the chest pain clinic.
You know, I have heard when I've made speeches, and people they're in the Zipper Club, they've had surgery in their heart, and that sometimes after you've had serious heart, whether it's operations, whether it's stents, whatever is there, that you go into depression. Why would that be?
Part of it is, one, you have gone through most likely deadly problem and you got out of it. There is time for people to just revisit what had happened, and before that they had surgery. Second thing, this is not absolutely proven, but by my experience, after surgery, when they go through the heart-lung machine and perfusion, there are some things that happen in the brain cells. It takes 4 to 6 weeks to return it to normal. And therefore, nowadays, most of the bypass surgery, if it can be done, is done off pump, so they don't lose much of the brain capacity, although it will regenerate as time goes by. The third thing I feel is once you wake up in ICU or in an intensive care unit, you hear these bells. The pumps that take intravenous fluid makes a kind of noise. And also, when you wake up, you're seeing unknown people looking at you all the time. So there is a time where people can have something called ICU psychosis. Mm. And in addition to that, they are not unable to physically move like they were doing before. That naturally can take a person's mind way down and can get depression. It's a very real thing.
That was terrific. I know you're really so smart because we didn't plan this conversation. You're just smart, and I love that because I know I have heard that, and I really haven't asked anybody about that. But you certainly have been around doing this. How long have you been practicing?
30 years, ever since.
30 years. You have a very young voice. It's such a pleasure to talk with you.
It is my pleasure. You have been so kind.
And tell me about how, when you met your husband, was he already a physician?
Yes, he was in his last year of medicine, and I was a medical student first year. I met him, and actually, if you you won't believe this, it is his father's brother who found me and told him, "I found your wife. You better marry her."
Oh, that's interesting. He probably said, "Yeah, right." And was it love at first sight?
Yes. We got married in 3 months. It's unheard of.
Oh, and so your parents, everyone was so happy. And
Yes.
I have been to an Indian wedding, and they are fantastic.
Yeah, I didn't have that glamorous wedding. But,
you didn't?
No. I had a simple wedding with a lot of people, and we were very, very happy.
Yeah. And do you have children?
Yes, we have only one son. He works in West Palm Beach with Ackerman Center Fit. He is a patent attorney. His name is Roy Zachariah.
I think I've heard of him now. So this is lovely. So now you're all here together.
Yes.
Well, I'm very happy. I mean, it's funny to have three first of all, with your name, it's not like there are three Joneses. But to have your name, it stands out, and it's just. It's lovely to have this. That's why when I saw you, I saw your name, I thought to myself, boy, you'd be great for all of you to come to the Cure Symposium. It's on a Saturday, so we do that intentionally so that we can get a lot of the physicians to come. But I just think I could do a lot of promotion on that. It's just something that's very delightful to think that a family, has come together this way. And I happen to love Broward Health, the Imperial Point. I mean, I'm involved in a lot of the hospitals, but there's something very special about that hospital, and your wonderful CEO is just such a lovely lady. And
yes.
So I'm glad they found you.
It is our honor and privilege, and we hope to do the very best we can. So the administration, Ms. Taylor,
yes,
and the staff will be very, very happy that we came. So it's time for us to get to work.
Yes, you're really going to do it. Let me tell everybody how to make an appointment. Let's say you're looking for a cardiologist, or you're looking, to just have some help with. You're not sure about your heart. This is what you would do. You would call 954-772-2200. That's 954-772-2200. Or you can actually go to browardhealth.com/BHIP, stands for Broward Health Imperial Point. And that way you can call and say you want to see Dr. Molly Ann Zachariah. And then if there's something else that she thinks that you need, she will certainly recommend you to go to either her husband. Now, does your husband and your brother,
Yes.
your husband and his brother do exactly the same?
They both do exactly the same. We all have the same qualification, but I don't do the invasive part.
Right. So how did they decide to both do this together?
Sometimes, in a family, they like the other one, what they're doing and how they're coming along. And I'm sure there is an innate nurturing that occurs early in life. And when you see others doing exactly what you'd love to come out of your work, the other one follows.
Yeah, because usually there are many families, of course, that have physicians, but usually they're in some sort of a different specialty. But
That's right.
yeah, this is just great. So
Yes.
I can imagine what the conversation at dinner time is.
You know how it goes.
Yeah, I'm sure it must be really terrific that that you're doing all this. And so, did you move? So you're living in Fort Lauderdale now?
Yes, I've been living in Fort Lauderdale for the last 30 years.
Oh, you have.
Yes,
Oh, I see. But you've just been at another. You've been working at
another facility.
I see.
Yeah.
So they grabbed you. Well, that was very
Yeah.
smart. I want to go back to something that you've been talking about. Can we cover? You were mentioning something about stroke, and so many times people have strokes and they never anticipated that. They were healthy. They thought. What happened?
When the stroke occurs, it could be due to multiple reasons. One, the most common reason is uncontrolled high blood pressure, which had been a silent problem. That usually produces something called embolic stroke, like a little clot, or bleeding. Bleeding is disastrous. That's when you see people have massive deficits, or they may pass away. The second type of stroke is blockage that build up in the carotid artery. That's the artery that takes blood to the brain from the heart, which was silent. The first symptom in many patients is stroke. That's the unfortunate part. That's where the preventative health comes in, like you said. If they start seeing physician above age 55 on a routine basis, and they themselves watch blood pressures by ambulatory blood pressure monitoring, this can be prevented. Second problem that can occur is just aging. Regardless, even if they do not have high blood pressure, you can have little plaques inside the big artery, aorta, and it can sometimes break away and go to the brain. All these are silent things that are happening when we are getting older. There is a group of young people who will get stroke because of some congenital problem where they have conditions like coarctation of the aorta, which is a narrowing of the artery, which they are born with, and that can be cured and corrected by appropriate diagnosis and intervention. So many a times, older people have no symptoms. They just get the big stroke. And some lucky people will get the transient ischemic attack, or TIA, as a warning. And they're lucky because they're going to be treated early.
I have another, it's a very strange question, but if we hear about cancer of the lungs, of the liver, of the prostate, I've not heard of cancer of the heart.
It does occur. It's very rare. These are like zebras in the road. In other words, very rare. But there is conditions where the heart can go into erratic beat called atrial fibrillation that causes clot inside the heart and take it to the brain. That's another form of stroke. Again, that's preventable if you go into preventative care sufficiently early. The cancer of the hearts are usually secondary to cancer from somewhere else. And rarely you can get a condition called sarcoma of the heart. That's not a good condition. Now, obviously, anything that happens to the heart itself is very dramatic, and if it's a primary cancer of the heart, it's usually not good at all. These are the times when you have to be with the tertiary care centers like Mayo Clinic or Cleveland Clinic and Johns Hopkins. And I'm sure in the coming years, all the hospitals, major hospitals, will be able to diagnose and treat. Now we can diagnose by doing MRI scan, echocardiogram, all other investigation. But the treatment usually, if they are young, they are better off going to people who have done these type of surgeries many times.
Yeah, that's so that was interesting. I thought I've never asked that question of anybody, but you seem so smart. I thought I'll just ask her and see see what happens. But let's stick with this for a moment. You said it seems like AFib, arterial fibrosis.
Atrial fibrillation.
Yes. So many people are being treated for this. Is this because we didn't know about it before, or why is that?
Number one reason, this beautiful country provides such a good medical care that people are picked up earlier. Second thing, people are living older, living much more older than before. So with a good quality of life, these things were never picked up because they didn't live long enough. Third thing is, like we talked before, high blood pressure seems to be the most common problem that ultimately causes atrial fibrillation, in addition to valve blockage or leaking that occurs as we age. Again, comes to the point of taking medications appropriately very early in your life if a problem is identified. People are usually afraid of medication, so they either deny it or don't take it. Once you start taking it, they are very, very careful. Atrial fibrillation is an end product of something else, a valve leaking, or the heart getting bigger, or had high blood pressure which was untreated. And there are electrophysiologists that are available now. They are electricians of the heart. They can convert it back to normal on the right person, or they can even ablate it, the special tract, by radio frequency or by cryo ablation. These are very common procedures, but not everybody is a candidate for these procedures. They have to see them and decide who is a candidate for the procedures that can bring the heart back to normal.
Well, Dr. Zachariah, it's been so wonderful talking to you. I look forward to meeting you in person, and we will talk again. So thank you so much for taking your time.
Your kindness appreciated, and thank you kindly.
All right, bye.
Bye-bye.